Welcome to the summary of sessions 6 to 9. It is my pleasure to start with the summary of session 6. And the topic was how to make childhood lifestyle healthier. It was Anarito starting off with the presentation of the Childhood Obesity Surveillance Initiative, an initiative by WHO that has made a difference in terms of epidemiology in pediatric obesity. And at the very beginning, it was about 10 years ago that 13 countries started out. And, in the last round, which was 2015 and 16, when data was collected, it was 35 countries. So they're very close to a full coverage of the European region. The special protocol that is being used is unique. This is the reason why the data quality is guaranteed. And what they are showing is a north-south gradient that is still to be seen from Northern Europe to Southern Europe, with countries such as Turkmenistan with a prevalence of overweight and obesity of 9% up to 42% in the southern parts of Europe. So a heterogeneous situation, but still with a high average prevalence of around 30% of overweight plus obesity. They also described relevant determinants of obesity, such as screen time, such as the consumption of fruit and vegetable, which is too low. And the good thing is that some countries are seeing a downward gradient over the last couple of years, and Portugal is one example with a reduction of about 13% over the last 10 years. So they must do something that is effective. And this is encouraging, I think, for all of us. The reason we also debated and underpresented data is a very comprehensive approach with policy in the focus and actions, different actions, policy actions taken. So that was Anarito. The next presentation was by Van Khan from Fontys University, who presented little bests in town, how environment and urbanization can drive children's health. And he recommended that stated that urbanization plays a major role. There's different kinds of environments. There's social environment, economic environment, physical environment. And urbanization is a major issue and can be considered a major chance for creating sufficient impact by fruits and vegetables and other lifestyle interventions. It is a challenge, but it can also be seen as a chance. And the creation of a health supportive urban environment contains changes in multiple types of environment. It also states that environments in which healthy alternatives take less effort than current unhealthy patterns are most likely to be successful. The easy choice has to be the healthy choice in this regard as well. Andrea Vani was the next presenting a very philosophical presentation of adolescence, stating that while the child moves from pre-puberty to post-puberty, he or she moves from complete dependence into independence. And this is this is the circumstance, this is the environment that we are working with these adolescents, and we need to take this into consideration. Andrea reminded us that it is absolutely necessary to take the perspective of the adolescent, not to just raise the finger, educate them, maybe even put pressure on them if you do, if you don't. No, it is important to take their perspective and offer them solutions that they can go along with. Diet in pregnancy has an impact both on health of the mother as well as on the health of the child, of the infant, and it has a consequence. And Dr. McAuliffe, who has done many studies on this topic, reminded us that this impact of the mother's nutrition on her own health is important. It is an option to impact on her own health, and it is an option of impacting on the child. They first looked at the effect of the glycemic index, but eventually realized that it's not only the glycemic impact that is relevant, that other macronutrients are important. At the end of the day, addressing glucose metabolism and the weight gain of the mother are important determinants of her own health and of the health of the child. So thank you, that's the first summary.